Welcome to IoT Week at CES. I'm Keith Kreischer, the Executive Director of the IoT M2M Council. And this is our News Desk Live video program with 25,000 product makers and designers, OEMs, enterprise users and apps developers as members. The IMC is the largest professional organization dedicated to the global IoT sector. Our mission is to accelerate the adoption of IoT technology for the public good, and we look at this morning's session on IoT and healthcare as exactly in keeping with that mission. I'll just quickly introduce our panelists. We've got Dan Sebula from Core, we've got Carmen Redondo from KYOCERA AVX, and we've got Martin Saylor from A1 Digital. I'll start by having you guys just talk a little bit about yourselves, your roles in your companies, and your company's role in the IoT ecosystem. Dan, we'll start with you. You're closest.
Yeah, sure. Thank you so much. Appreciate you guys having me a part of this panel. My name is Dan Sebula. As Keith mentioned, I work with Core Wireless, and we've been around for 20 years, sort of no stranger to the IoT and M2M space. About 2 years ago, by way of acquisition, we sort of focused in on the healthcare and life sciences space, which is the team that I'm a part of. So specifically working with solution providers, remote patient monitoring companies, clinical research organizations, medtech OEMs, to help them connect their devices to the internet and sort of make it easy and simplify the complexities around that.
Great, thanks. Carmen.
Hello, thank you for inviting me here. My name is Carmen Redondo. I'm Global Director of Marketing for KYOCERA AVX. KYOCERA AVX is a leading manufacturer of electronic components, connectors, capacitors, sensors, and I'm in charge of one of the products, which is antennas.
Thanks, Carmen. Mark?
Yes, hello. Thanks for having me. I'm quite loud here. My name is Martin. I'm working as a senior IoT consultant at A1 Digital. We are guiding our customers in the digital journey, at their digital transformation journey, and we are supporting them actually with full end-to-end solutions, which means we have devices, we have connectivity, we have the platform, we have also analytic services, and we are there to have the full solution for our customers and make them ready to use them then also for their end customers.
Terrific stuff, guys. Going to start off with some general sort of topics about healthcare and sort of drill down as we go. So starting out, where do you as a group think that patient engagement has been most and to the greatest extent affected by IoT technology? And I'll start with you, Dan.
Yeah, sure. Thank you. I think really the biggest area that we're seeing increased engagement around is just that continuous, the ability to sort of receive continuous monitoring. That allows patients to be more engaged. It allows doctors to be more engaged, proactive in providing care. And so, the more we can put the power of the ability to sort of keep track of your own health back into the patient's hand is where we're seeing that engagement.
Right. Martin, a little bit of a sidestep on that same topic. What IoT inventions do you think have the potential to have the most impact on the healthcare sector?
Yeah, very good question. I think I would like to come from the direction of the solution itself. So we always have different sensors. We always have a connectivity layer. It could be different connectivity. It could be Bluetooth. It could be a mobile network. And you always need to have a platform where you can collect all this data. And what we see in the market is that there are several new sensors. So you have not only you can measure in the meantime 24/7 the temperature of a human being, or you have it in the smartwatches, you have the heart rate, but you have also sensors in a smart shirt where you can really measure the breathing, if a human being is still breathing, or if there's a change in the behavior, which means this has a huge effect. On the one hand side, you can see this at the doctor's office, but you can also see this in your private life. If you're doing sports, if you're just sleeping at home, if you're ill, if you have the temperature always there with a sticker, you can even detect earlier some diseases, and you can react much quicker, which means the mass of sensors deployed in the world are just helping us getting better, having more reliable data, and this means at the end of the day we have better treatment for all our patients in the healthcare sector.
Right, no doubt that the amount of data we're collecting is very significant. But Carmen, going to you, how is the communications of that data actually taking place? You know, we'll be talking about wearables and ingestibles in a few minutes here, but just talk to us about the communication layer in the stack. That's where KYOCERA AVX is most active, obviously.
Yes, certainly. We are looking at the communication level about, so it's very important the reliability of the communication, right? Because if you are having your device communicating, but at the end you don't have the proper antenna, for example, then there could be a risk for, especially when you are talking about healthcare. So that is very important. And we see, for example, we have a lot of customers who were doing devices for communicating during the COVID, right? Because people couldn't go to the doctors and they need to talk to the doctors with the device, sending the data from their testing, doing it at home. And of course, you need to make sure that it's a reliable connection.
Right. Moving right along, like to talk a little bit about the benefit side of the equation. You know, how is this benefiting patients, and what are the largest benefits you're seeing, Dan?
Yeah, you know, we talked about patient engagement, you know, earlier in the first question. I think, you know, again, giving the patient the ability to sort of be, you know, proactive in receiving care as opposed to reactive is probably one of the biggest improvements. If you just think about sort of different chronic disease states that remote patient monitoring is typically deployed in, you know, patients with hypertension, with diabetes, you know, giving them real access to real-time data, not only giving them access to the data, but then leveraging or allowing the caregiver to be proactive in providing care. But also many of those solutions are, you know, delivered on a phone or a tablet, and so now you take those biometric readings and sort of add on top of that, layer on top of that educational content. So now you're sort of changing behavior around, you know, the patient, you know, engaging with their own care, and so long term, you're seeing much better clinical outcomes.
Right. Patient monitoring, no doubt, a huge topic, but IoT in the hospital is also a very big topic. Martin, talk to us about that some. You know, how do you see IoT changing daily life for a patient in a hospital?
Actually, I would like to follow up also on your
Sure.
answer. I think it's very important if we have ongoing measurements, if we have more measurements, these are huge benefits for everybody. For instance, my girlfriend is a nurse, and sometimes they need to wake up patients in the night, and they do measurements and stuff like that, which means if you have just connected sensors on your smartwatch, some stickers, whatever, then you don't need to wake them up, and there we are exactly at the hospital already.
Right.
So you can connect on the one hand side the patient much better, which means you have all the live data. You can get the data out of it. You can put it in a digital system to the doctors, but you can also put it to the nurses that they react carefully and in the right way. But this is only one part. Another part, when we come more to the hospital itself, to run a hospital, you have a lot of assets. You have beds, you have wheelchairs, you have pumps, you have ventilators, whatever. And a big part is that you know where these assets are around. There are a lot of problems in the hospitals with just not finding the beds. They don't know, are the beds ready to use or not? Where are they? You know, you bring a patient from the first level to the third, and then the allocation is different. And here we have a huge potential actually, and we see huge requirements on that we really digitalize all the assets in a hospital. So you know exactly how many beds are free, where are these beds, what were the latest actions which you have performed on there, which means you have kind of a digital twin set for the whole hospital, not only for the patient itself, but also for all the assets which are in the hospital. And this is also a big part.
Would you like to add something to that?
Yeah, I was just going to add to that. Obviously, knowing where all the things are is really important, but having access to additional resources as well. So, you know, one of the big things that we've seen with really the adoption of 5G private LTE networks is now you've got the ability to leverage specialist resources that, you know, may not be located at, you know, all of your hospitals, right? You don't have the ability to have those at every one of your facilities. So now you can engage with those healthcare specialists, no matter where they are in the world. You know, being able to use AI, artificial intelligence to engage with them, you know, anywhere they are with the patient, you know, from sort of their bedside.
There's a lot going on, no doubt.
Yeah.
No doubt. But we're at CES, and CES is all about cutting-edge technology and cutting-edge in healthcare. when it comes to IoT is all about ingestibles and wearables, delivering data from a mobile patient. Carmen, I know KYOCERA AVX is very active in that area. Talk to us about that. What are the challenges involved in outfitting those cutting-edge technologies?
Yeah, well, the biggest challenge is the human body, because most all the wearables are close to the body. The ingestibles, of course, it goes inside the body. And when you're talking about healthcare, you need to have this reliability. It's not the same to have a sport watch when you are running and suddenly it doesn't connect. It's not as important as you are wearing a wearable, which is transmitting data from your health, right? If you have a heart attack, you want to make sure that the doctor or the hospital is receiving this data, not like, it's loading and you are in an area where you don't have coverage, right? So this is very, very important to
What are the challenges that sounds like a challenge that's already been met. What are the challenges in front of us when it comes to antenna technology?
So with the 5G, it's now more implemented. As you see, there will be more and more actions in the hospitals that will be remote. So the low latency is very important, because you are doing a surgery, for example, and you don't have the real data, it can be something very critical. So reliability, you need to have low latency, and the most important, as a general comment, is the awareness of our customers, because some customers don't realize about the importance of this topic. They think it's something like consumer electronics of other IoT devices, and this is quite critical to have in mind.
Can you give us an example or two of antenna technology being deployed then?
So, for example, for the injectables, we use some technologies called LDS, which is laser direct structuring, where we have directly the antenna implemented in the plastic. So that means that when you ingestible, so you make sure that the antenna is there. There's not going to be any issues during the process, because we have a lot of products that we have in production where it goes through it and you send data from inside the body. So it's very important to have this reliability, not only in the connection but also in the manufacturing.
Right. Great to talk about the cutting edge technology, but another issue facing the healthcare industry as it pertains to IoT is patient privacy. So, Dan, talk to us a little bit about patient privacy. What's being done to address that?
Yeah, I think in general, if you look at IoT, whether it's healthcare or any application, security needs to be sort of foundational to the solution. From a hardware perspective, that's something that we take very seriously. We work with our customers from a development perspective. On the connectivity and sort of enablement side, we do that as well. So, whether that's running that traffic over a VPN, whether it's leveraging IoT safe, so taking the actual SIM card itself, leveraging the secure element of that to basically store your credentials to engage with a cloud platform like AWS. We've also built a connected health telemetry solution, which is really like a suite of enablement tools that allows RPM providers and clinical research organizations to scale. And so that solution itself as well fully encrypts data from the edge device, from those sensors all the way to the cloud as well. So certainly we work with our customers to make sure that they're implementing security, but then we're adding additional layers on top of that to protect patient privacy.
Right. Martin, talk to us. I know A1 Digital also has something to say about security. So talk to us about how IoT is affecting communications between doctors and patients as it pertains to security.
Yeah. There was so many truth already in that, and I think we all, as we are sitting here as representatives of technological companies, we have the responsibility to make the system secure and to give trust to the end customers, to the patients, that they're really using the systems. And especially when it comes then also to the communication channel between the patients and between the doctors, it's very important that we meet all that requirements. And here we can see also a lot has changed actually in the past. So nowadays we have some very easy to use devices also for older people. They can just call for help, they can just call the doctor, especially during the Corona times. We saw that it's very important that not everybody is always in the doctor's office, but instead they have other communication channels as well. So it's not only about the sensors taking really the data, but it's also about the communication itself. So we support also companies in that matter, that there are ongoing communication channels, that you have really a live one-to-one session, and you can, in the best case, you can directly, the doctor can get all your parameters, so you have a similar treatment, although you are at home, and this is in a secure manner, and the data is stored in a secured cloud. Yeah.
Great stuff. Great stuff. Hey, I'm going to wind us down here and just give each of you a chance to talk to us about what you think is the most important implication of IoT in healthcare. I'll start with you, Carmen.
Well, as I was mentioning in the panel, yeah, I think the reliability of the connectivity is the most important to have in mind.
And how is that being addressed? I mean, in the hardware sense.
In the hardware sense, so we are doing a lot of testing. I think it's very important that we work with our customer to make all the validations. You know, especially medical is a bit longer testing than the normal consumer electronics, and to have the certifications and everything in place to make sure it works properly.
Right. So product verification, so to speak. Martin, talk to us about A1 and what you guys are doing, and what do you see as the most important thing out there?
The most important thing from my point of view is that the IoT solution contains the right stack, that it's working not only in one area, but it's working in various areas, so that you can also scale your product. And it's very important that it's easy to use, because customers would like to have products, they are easy to use, they should just simply work, no matter which sensors you are talking about. And there are a lot of sensors, there are even a lot of actors already, which can then proactively treat you. So if you sense a kind of a disease, then you can directly take measures. And the key is that it's easy to use and that it's working, and this is why we are there for it.
Right. And Dan, core, obviously, connectivity is where you guys live.
Yeah, certainly from a technology perspective, whether it's connectivity, hardware, services, those are all key elements. But, frankly, to me, the biggest piece around the success of healthcare really is evident in sort of what we saw happen during the pandemic. We don't have the existing infrastructure to support the current aging population. So we have to find technology that's deployed in the home where the patients are in order to deliver care. All of the stuff that we're talking about, typically, those are not core competencies of our customers. They're not SIM experts, they're not antenna experts, they're not logistics experts, and so it's us as experts, it's imperative that we provide them the tools, the solutions. We sort of talk about it at Core, eliminate the complexities of deploying an IoT solution, whether that's in healthcare or not. And so we have to do that in order to ensure that they can, be experts at delivering and improving clinical outcomes.
Terrific. Hey, 3 companies that are promoting IoT technology for the public good: A1 Digital, KYOCERA AVX, Core. Thank you, Martin,
Yeah, thank
Carmen,
you.
and Dan. Thanks, guys.
Thank you.
Terrific stuff.
Thank you very much.